I woke up watching news and finding out we are going to give Argentina a $20 billion bailout while we can't even have health care in this country. And we're falling apart. And our beautiful fucking orange wannabe God seems to think he needs a Nobel Peace Prize, which I don't understand because he's tearing our country apart. I'm really not crazy. I really never knew this. I am 60 years old. And for the first time in my life, I am scared to death to live in this country. I want to take my family and leave. I can't afford passports, imagine. But anyway, please, if you agree with me, call your senators, protest, do whatever you can. But I don't understand why we are giving another country $20 billion when so many people are on the verge of losing health care, so many rural hospitals are on the verge of closing. When this ACA or whatever they want to call it, Obamacare ends, everybody's premiums are shooting up. Not just the poor people you think are on Obamacare, but everybody's, because a whole system's going to have to absorb this. The system's going to have to absorb people that can't afford it and have to go to the emergency room for treatment, and that's all they can get. So we're going to let our people just lay here and die because they can't get health care, but we're going to bail out other countries? I don't understand. Please, if you agree with me and you think something needs to be done, just call your senators and tell them, please. Thank you for listening to my whiny post.
I'm literally crying in my car, bawling my eyes out because I'm just so tired of this government and this country just taking advantage of their people, like protecting the freaking evil people.
Why are you voting to cut Medicaid? Why are you voting on Medicaid cuts? Can you tell us why?
Medicaid saves lives.
This baby is on Medicaid. This baby's life is saved because of Medicaid, and you are voting to reduce Medicaid. Look, you can run away from us now, but you can't run away from a bad vote. The people will remember.
It's over. It passed. And this is what that means for so many Americans. Billions of dollars cut from Medicaid, which affects millions of Americans. The poorest of the poor people in this country are going to lose their health care, be unable to feed themselves, and this is what people wanted. And the richest people in this country will get a tax cut. So if you're not upset, then I'm confused. If this is what you want, I think you need to take a much deeper look at who you are and what you stand for, because this is devastating to so many people in this country. You were often one step away from needing assistance. One step.
Trump voters thought they were voting against someone else, only to find out they were voting against themselves. They cheered when the cuts were being announced, only to realize that the cuts were coming for them too. They now realize that the cuts was never about cutting waste. It was about cutting people. So let's have a look.
So what's happening with nursing homes is really terrifying. Already, nursing homes are taking patients and dropping them off at homeless shelters. They're just taking patients and dropping them off at homeless shelters because they know that the cuts that are coming from Medicaid are going to decimate the nursing home industry, and they're trying to get these people out of their services before the cuts go into effect, because when they passed the big beautiful bill, they made sure that the cuts don't go into effect until after the midterm elections. But after the midterms next year, Medicaid cuts are going to go into effect, and a whole bunch of nursing homes are no longer going to be able to pay for all of the patients that they have. And those patients that don't have the money and are on Medicaid and don't have any way to, take care of themselves, they're going to drop them off at homeless shelters. That's what's going to happen. And we are going to be flooded with really, really old people who are unable to take care of themselves, who are now going to be on the streets. Why? Because Donald Trump and the Republicans wanted to cut all the Medicare money, which means these nursing homes will no longer be able to afford to take care of these people. And they're not going to do it for free because this is America.
I just have a quick question. Quick question to MAGA, especially all you MAGA nuts that are on Medicare and Medicaid. Are y'all still gonna be rocking y'all red, white, and blue tomorrow? Because I don't know if those colors suit you guys. You should probably be looking more in the darker, like a dark gray, preferably black, because yeah, not to be mean or anything, but a lot of your families are going to be burying you soon. Yeah, because you voted for your own demise. And unfortunately, a lot of other people are going to suffer for your selfish ass choices.
First off, Medicaid is AID, so there's that. Number two, stop falling for stupid shit. They already proved that the people on Medicaid that are going to lose Medicaid are not committing fraud. My 70-year-old grandmother is not committing fraud. The disabled veteran is not committing fraud. The 8-year-old that needs Medicaid because his mom doesn't make enough money working 3 jobs is not committing fraud. And here's a further point. Every single person on the planet deserves health care. Period. 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 There is no more. Full stop. Take your opinion. You know what to do with it. People deserve health care. Period. I am happy to pay. If it means that people don't have to suffer and not have health care they need, I am happy to pay. Raise my taxes. Do it. I would much rather my taxes go towards Medicaid or some form of social health care so that everyone is taken care of. Food assistance so that everyone has food to eat. Housing assistance so that people have a place to live, than spending $900 billion on fucking airplanes we don't goddamn need to invade countries we got no business in. Raising the wages for Congress when they don't do the right thing anyway. Tax cuts for the ultra wealthy. That is not where I want my taxes to go. I will gladly pay more in taxes if it means everyone in this country has medical has the medical assistance, has the medical care they need, food to eat, and a place to live. I will gladly pay more in taxes. Gladly.
Okay, New Jersey, we gotta talk. And really, other states need to listen in too, because this is coming down the pike for you. This article just came out today. It says 12 New Jersey hospitals could face closure after federal Medicaid cuts, aka the big beautiful bill. And these are not small hospitals either. 300,000 New Jerseyans are at risk of losing their health insurance. And my job as a psych NP is actually funded through Perform Care, which is the Medicaid state system that pays for psychiatric care for children. So let's take a look at the list. There is Palisades Medical Center, not a huge hospital at all. There's East Orange Hospital, also not a big hospital. We have Inspira Medical Center, that's a big hospital. St. Michael's, Capital Health Regional Medical Center in Trenton, Bayonne Medical Center, decent sized hospital. Clara Moss serves a lot of people. Trinitas serves a lot of people. RWJ University Hospital in New Brunswick. This is a massive hospital. We also have Monmouth Medical Center in Lakewood. That's a geriatric institute. They specialize in caring for the elderly. We also have Hoboken University Medical Center and Newark Beth Israel Medical Center, which is a massive hospital. If these hospitals shut down or get cut tons of funding, what's particularly concerning to me as a psych nurse practitioner is that a lot of these hospitals on this list have both adult and child adolescent psychiatric inpatient units. We will be losing a lot of psychiatric inpatient beds. This is going to severely impact the psychiatric field. Now, Trinitas Hospital in Elizabeth, I have some thoughts about them, but what I'm going to focus on here is the fact that they actually have an intermediary unit for kids, meaning if a kid can't go home because they are that unsafe and they are waiting for a bed at a longer placement unit, Trinitas can hold them for longer so that they are not at risk of being unsafe at home. Where is the America First in this? Now, the new governor, Mikey Sherrill, is trying to help with this. Her new budget accounts for some of this, but it can't account for all of it. What really concerns me is that people from certain areas are going to have to go far to get to a hospital. Let's just say Elizabeth. You're from Elizabeth or surrounding areas. What, you're going to get to University Hospital in Newark or RWJ New Brunswick, if that even stays open? Overlook Hospital is still going to be 30 to 40 minutes away, and this will disproportionately affect Black and brown communities, underserved populations. I am not fear-mongering. A lot of people will not be able to get help. I hope I don't have to say it. New Jerseyans, this will cripple our healthcare system. So many Americans are going to be losing their healthcare, but politicians are wasting our time with proposing legislation to put Trump's face on Mount fucking Rushmore. I don't want to hear about making sure that illegals don't get health care, because this is the 100% truth. I have been working in this field for over 21 years, and 100% of my patients are on Medicaid. I have not had not one single patient who wasn't a citizen. If there was so much fraud, surely I would have had at least one. Please spread this around to make sure people know.
Okay, so Trump's budget is already having an impact with regard to Medicaid cuts. So there's $1 trillion in Medicaid cuts over the next 10 years. This is a primary form of health insurance for people who are in poverty, who have disabilities, and so forth. And already you guys may have already seen the one gentleman talking about how his wife, who works for a children's hospital, they had an emergency meeting with the staff about how are they going to be able to afford to take care of children. Now, if you've ever been in a children's hospital, these are the innocents. These are the innocent children who are battling really serious stuff to have to go to a children's hospital. They've got their burn units. This chokes me up because I used to do dog therapy there, bring my greyhound there. Cancers and all kinds of stuff. And, the staff at this children's hospital was stating that so many of the children they treat are on Medicaid. There's a lot of rumors by MAGA supporters at how this is going to save Americans money because illegals are no longer going to be getting Medicaid. They never did. They never could. And once you become naturalized, you still have to wait 5 years to get access to it. So this isn't going to hurt them or save us any money. It's only going to hurt Americans. It looks like 300 rural hospitals are preparing to close over the next couple of years. They were already struggling financially, barely staying afloat. One smaller hospital in Curtis, Nebraska just closed and said it was due to the budget cuts. Like they have been struggling to keep it open. Now, there's a lot of Republicans who live in these rural areas. So I don't know if you guys have ever been in an emergency situation where you call an ambulance and like within 15 or 20 minutes you're going to be at the ER. No, you better hope that you don't have to wait. You can hang in there for 40, 50 minutes, however long the drive is going to be. You're choking on something, having a heart attack. This is painful. Kentucky, the red state of Kentucky, is set to lose the most, $12.3 billion. Like other red states, it has one of the highest poverty rates. I don't know why these red states who have been perpetually in poverty keep electing Republicans that are helping to keep them in poverty. In Kentucky, it's looking like 35 rural hospitals will close and over 200,000 Kentuckians will lose their health coverage.
It was an open book test. The policies were there. The intentions were clear, but they thought that the pain was intended for other people, the immigrants, the minorities, and the poor. They were sold the politics of fear and division to believe that the real threat was someone else, and now the truth is unavoidable. When rural hospitals start closing, when nursing homes struggle to stay open, and when families delayed medical care just because they can't afford it, the impact spreads beyond politics. The entire communities begin to suffer. We are talking about a child who cannot get treatment, an elderly person who has to worry about being displaced, a disabled person who depends on care just to survive, a single mother choosing between food and medicine, a veteran who served the nation who now is struggling to access basic health care. And the people being hit the hardest are the ones who believe that they were voting for protection, for stability, and a better future. And it's so funny that the poorest states, they continue voting for policies that leave them even more vulnerable. But the answer is this: when people are being convinced that someone else is a problem, they stop looking at the system itself. They vote based on fear, identity, or even loyalty instead of outcomes. But consequences, don't care who you voted for. They don't care about your political loyalty before they hit. Now many are not realizing that healthcare is not a luxury. It is survival. It is dignity. People are even more frustrated when they see that there is money for conflict, there is money for funding other countries, while people at home are struggling to afford healthcare and basic survival. But the lesson is this: voting has real consequences that goes beyond slogans and rallies. The way you vote, it shapes policy and it shapes lives. It is important to look beyond emotions, and ask yourself, does this actually help me? Does this help my family? Does this help my community? Because at the end of the day, healthcare should never be about political, It should be something that people rely on consistently, fairly, and humanly. So thank you so much for tuning in. Be sure to like, subscribe, and share. Have a good one. I'll see you in the next video.